Welcome to Politics Done Right. We are here with Lisa Rice. Lisa, I interviewed somebody today, and it's great that I'm interviewing you as well. He had a healthcare in the United States. He also had healthcare in Canada. Of course, Canada has a more of a centralized healthcare system by province. We have insurance companies with middle persons, and people are selling and all that kind of stuff. Um, I I want to get your opinion as somebody who has been vested in our system, having had a and recent issue. Please feel free to talk about it if you will. What do you think is the state of our healthcare system after going through what you've gone through?
Ooh, that's wow. Okay, so the background is I am a cancer survivor. I was diagnosed with breast cancer in 2017. Have had multiple related and unrelated surgeries to get rid of the cancer, to get rid of other organs that might spread the cancer, et cetera, without going into too much detail. But I am lucky. I am not independently wealthy, but I have health insurance, really good health insurance. And so I was able to pick and choose my care teams. I and I'm very picky. I interviewed 4 different care teams at 4 different hospitals before I decided on the care team I wanted. So I make no mistake in understanding that I'm very privileged, very privileged. I'm the vice chair of the board of directors for the National Coalition for Cancer Survivorship, and I happened to be at a dinner just last night with several ambassadors that we have, and these are volunteer advocates from all over the country, and we are funding them because they have programs that they've created in their minds, and they've come together, and we're going to help send them on their way with their funding to build these programs. And I sat by a woman who had been diagnosed with metastatic breast cancer, and she was saying that she lost her care team when she moved to a different state, and she can't see the scans because in Nevada they don't have the same level of requirement for clarity of scans. So the scans that she's receiving in Nevada aren't even clear enough for her provider to understand. And she has health insurance, but but we have so many people that don't have health insurance. We have so many people who are just, I mean, the state, what was your question? Like, I get really
I want you to continue because you're right on point. I keep telling that story. Because I'll come in after.
I mean, the state of our healthcare in this country is it's miserable, unless you're independently wealthy. And even if you're independently wealthy, if you don't have an advocate, you could be getting substandard care, but you're just writing a check for it and think you're getting the best care.
One of the reasons I wanted that is you have good health insurance, and not only do you have good health insurance, you had good outcomes because you were able to select a team. You realize that you're a privileged person in being able to have all of that.
Absolutely.
And realize that you're in less than a 10% of what America has. And you, as an individual, acknowledges that we do have issues with our healthcare system. Are you an advocate for something like Medicare for All?
I can't speak to Medicare for All because I haven't really studied it, but I will say, Medicare as the coverage system, I'm not familiar enough to say that. I will say that I want every person in this country to have access to healthcare. Is that Medicare? I don't know. I don't know the mechanism, but I believe that everybody in this country should be a healthy body.
Lisa Rice, thank you so kindly for being on Politics Done Right.
You're welcome.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.